Hey folks, welcome back. Hope you're doing well out there. So I thought in today's video it would be fun to kind of go back to the basics here, go back to my roots a little bit of talking about psychedelics and address a question that I almost never see discussed online or talked about much, but might be super useful to some of you out there, which is how to take care of yourself, or what are some good self-care practices to do during your journey while you're on the medicine. So whether we're talking psilocybin or LSD or other classic psychedelics like that, what are some things you can do to really optimize for the most comfortable, balanced, safe, useful experience on the medicine? So let's talk about it. All right. So have you ever wondered why it is that people who use a lot of psychedelics tend to kind of drift in this direction of being really into wellness and yoga and body care and clean diet and all the kind of memes, all the like mimetic kind of, world traveler kind of hippie cliches, right? Why is it that people who use a lot of psychedelics drift in that direction in general? I want to submit to you that there's a reason why these things become popular among psychedelic users, and discuss with you a bit today some of the kind of basic things you can do that I've found to be really helpful if you're taking medicine and for a reason you're finding yourself a bit uncomfortable, a bit out of sorts, etc. We're not going to be talking about extreme cases where someone's overdosed on psychedelics here and, they're going bonkers and, that kind of a thing. We are also not going to be going to discussing all the things you can do. Okay. So if you have questions or you have suggestions or you want a follow-up video and maybe make a small series out of this, I'm happy to do that. Leave a suggestion in the comment section down below if you have something you want me to address more. But I thought I would just kind of touch upon some of the basic garden variety issues and experiences that people have on psychedelics, especially, again, if we're talking psilocybin or LSD or something like that, which is fairly common to be used, and what some of the things are that you can do. So full disclosure here, part of the reason I'm sharing this is I had my own recent experience where I took a fairly high dose, which it's the largest dose I've taken in, let's say, quite a while, many years. Okay. And it was wonderful. It was awesome. I had a great time. I loved it. It was very life affirming, but I was certainly at the edge of my comfort for a good chunk of it, which I think is to be expected if you haven't done a big dose in a long time and then you take a big dose of psychedelics. You do have to get your sea legs a bit. You do have to kind of work your way up back to comfort with those kinds of sensations and experiences. And even then, even when you're in your groove with taking psychedelics, it can always pivot on you. It can always change. You can always have that one day, that one moment for whatever reason, whether that's neurological weather, whether that's something you ate, etc. So this is always kind of evergreen information I'm about to share here with you. But while I was having that experience, one of the things that dawned on me is how much I knew what to do for myself because I'd been there so many times before, and how grateful I was to know what to do, and how many folks out there who are perhaps new to psychedelics or just exploring them may find themselves shocked with how uncomfortable they feel, how tense their body feels, nausea, confusion, overwhelm, lots of other experiences, and not really know what to do. And I know there's a lot of information out there, especially if you're prone to searching on Reddit. There's a lot of great information there on different things you can do. But I thought I would just kind of make this video, again, for anyone out there who wants to know. Okay, so I know I'm repeating myself, yada, yada, blah, blah. Hopefully you get me. So let's go ahead and get into some of the symptoms here and some of the things I find useful that you might too. Okay, so let's start in a really fun place and start with nausea here. So I believe I've done a video on this before, but like any good YouTuber, I need to kind of re-up on some of these kind of core talking points on the channel here. Nausea is something that I've never personally experienced really in any significant way on LSD. I've certainly had gas, which is a kind of well-known phenomenon, particularly if you're eating blotter acid or something like that. Though even with liquid, it can happen. But psilocybin is the obvious culprit here in terms of nausea with psychedelics, right? Or sometimes mescaline, especially if you're doing San Pedro here. Obviously, ayahuasca also applies here because it is a purgative. It is kind of nauseating, to some degree, depending on how much you tolerate it and how it's brewed and all that. Uh, so this applies to a lot of the kind of plant medicine side of things. And, I am not a big, to full disclosure here, I'm not a big fan of nausea. It's something I used to have a phobia about. I don't like being sick in that way. I don't tolerate it well. It's something I kind of actively try to avoid. So for me, this is something I've spent a lot of time trying to figure out ways to kind of manage and work around. And interestingly enough, when I was younger, it was never an issue with psilocybin. I'd eat mushrooms and I'd never get nauseous, almost never. Now I do white more frequently, and I notice a lot of other people do. Again, I don't know why that is. Maybe stronger mushrooms are being cultivated now. Could be a lot of different things, but certainly seems to be a theme. So here are just a few things I would recommend for nausea. Again, this can, I have heard of it popping up on LSD. I've heard of people getting nausea on MDMA. If you're thinking of this in the context of MDMA, do some research, like hop on a, ChatGPT or something like that, and look into contraindications here between any of these and MDMA. But I don't think any of these should be too much of an issue, except for one, which I'll point out here. So for nausea, my kind of top pick here, the thing I'd recommend the most would be fresh ginger. Now, people often see ginger online. They go, okay, great. I'll make a ginger tea with a ginger tea bag of some old ass, dried up, weak fucking ginger. No. Okay. Get yourself some fresh, ideally organic matters here, because ginger is a root. Roots soak up stuff. So you do the math there. Get some fresh ginger. As fresh as you can get it. Potent, sharp, pungent ginger. Cut it up into slices and chew on it directly. Yes, it's going to be spicy. It's going to be way stronger than that cup of tea. But it works incredibly, incredibly well. I think the basics, as far as I understand of the mechanics of what ginger does, is it interrupts the signaling that tells the brain that you're nauseous and need to throw up, and just kind of stops that signal from coming. So your body just, digests whatever it is instead of wanting to purge it. So fresh ginger would be my first port of call here. It has gotten me through many a rough moment on journeys. Both psilocybin, ayahuasca, it's a fantastic tool. Have more than you need on hand. I like to just have it fresh chopped, ready to go. That way, if the nausea comes up, I don't need to go while I'm tripping, go to the kitchen and get a knife and a cutting board and try to figure all that out. So prep it ahead of time, have it ready to go, but keep it as fresh as you can. And chew on as much as you need. It is intense. It will overwhelm you, especially if you're on a psychedelic, obviously. But it is worth it. The payoff is worth it. If that's too much for you and that's too intense and too overstimulating, I get it. Another good alternative to ginger would be, believe it or not, and this is not the same thing as the tea, candied ginger. So you could go to, say, Whole Foods or a similar health food store, or order out on Amazon. Candied ginger will be dried ginger chunks. It's actual real ginger with kind of sugar coating on top of it, and it does make it more palatable, more comfortable to use, and certainly will get you out of a pinch as well. Highly recommended. I've also used ginger chews before. I don't recommend them as much. It's a lot in the mouth when you're high, and also they're not often as potent, but you do you. Maybe that'll work just fine for you. And again, if you need to make tea because that's all you have, cool, it's better than nothing. Ginger tincture can work as well, but again, fresh ginger, that's the banger here. Second one I would recommend here, I would not recommend for MDMA because it does contain MAOIs, and what I'm talking about here, though mild, right? So probably safe. Again, do your research and don't take anything. I'm just a weird guy on the internet. Don't take anything I say as, gospel truth here, but curing pills, CURING, which are a Chinese medicine pill for morning sickness or nausea or travel sickness. They're anti-nausea pills, essentially. Very much like ginger, they kind of are a little bit spicy. You kind of burp. It almost tastes like patchouli a little bit, which is not my favorite, but it works. And they go in and kind of help your digestion, smooth things out, calm things down. They're very effective. I've used them many, many times with, say, psilocybin, and they have been a saving grace. Again, there may be a mild MAOI in there. I didn't find it to be an issue on a classic psychedelic, but I would be careful with MDMA of any risk of serotonin syndrome. You don't want to mess with that. So do your own research. If you're doing MDMA, don't use curing pills. Just use ginger. That's an unknown, decent combination, good combination. So just so you know. Other one that I have not tried, but a lot of my clients have used and said is highly effective, if you can get it, is Zofran, which is I believe a prescription medication. I don't know if you can get it over the counter, but if you can get it, it's an antiemetic. It is made for, say, people going through chemotherapy or prone to nausea and don't want to be throwing up all the time. Apparently it works very well. I've also heard some people, push back and say that, sure, it stops you from actually throwing up, but, the downside is that you're still uncomfortable. You're still nauseous, right? So I don't know if that's true. I haven't taken it, but that would be another option that a lot of people kind of, say is great. I've also seen, of course, there's, the memes online of, lemon teching or adding banana or avocado, which break down the chitin and psilocybin. And that's all very debatable. Those are that's presuming that the nausea is just from the chitin, which may or may not be true. We don't know that I don't think there's any studies to verify that one way or the other. So I would aim more at the nausea than at the breaking down of the chitin and the enzymatic approach, but you could always combine the two and do a smoothie with a bunch of ginger and some bananas and avocados, and maybe that's the winner here. So anyways, these are the tools I found to be super useful. Ginger is so clutch if you find yourself suddenly nauseous on a trip. So food for thought there. All right, next up is everyone's favorite, anxiety, right? Everyone loves to feel anxious. When it comes to anxiety, there are a lot of different things you can do, and some are going to impact the trip more than others, right? So anxiety could be a lot of things. So first of all, from a therapeutic perspective, anxiety could be your deeper nervous system kind of bringing up something to heal, some sort of dysregulation, some sort of core issue, or even just a somatic memory, a body-based memory of anxiety from the past as a kind of nervous system pattern that it's wanting to let go of or move through. In general, with anxiety, what's going to be helpful here is to tune into it, to get curious with it, rather than to push it away, ignore it, not try to deal with it, try to suppress it. In general, that's going to be a better mode, but you really do need to detach a little bit to be able to witness it and be present with it and tolerate it. With that being said, let's say you're doing recreational psychedelics at a festival or a concert or something, and anxiety is coming up and it's not the right moment to sit there and feel anxious, right? What do you do? Or for whatever reason, maybe it's too much anxiety. What do you do? I mean, there's all kinds of stuff you can do. Obviously, there's the whole pharmaceutical route with things like beta blockers, stuff like that. There is breath techniques, right? So you could do, for example, box breathing or slowing down your heart rate, slowing down your breath. But, a good chunk of this is the hypertension, the raised blood pressure, the kind of elevated, activated nervous system, just like popping off. And it can feel really hard to actually control the anxiety when you're on the medicine. At least that's been my experience a bunch of times. Things that I find really help here, magnesium. A lot of times what's going on is you might be deficient in magnesium. When we're stressed, we tend to burn magnesium, as far as I understand it. It's one of these electrolytes that goes really quickly. And so one of the things I would pivot to right away is, a good dose of magnesium. I would also look at other kind of GABAergic supplements, okay? Instead of like going full benzodiazepine, which we know will blunt or kill a trip. Instead of going that intensely, see if you could just take a little bit of the edge off by, again, magnesium or lavender oil Or you might also GABA, just straight up GABA. But again, careful with the dose because too much and you will blunt your experience and it won't be fun or vivid or vibrant. You could also look at things like valerian, right? Or passion flower extract. I'd be a little careful with those, not only because, they do the same thing here in terms of blunting, but also in my experience, when you start to add those particular herbs into a psychedelic experience, your visuals and your visions will really change and things become much more strange and weird and a little bit dark and earthy. And it can really turn the journey in a different tone and direction than maybe you like, unless you like that kind of thing. So be aware of that. In general, my first thing, if I was going to be dealing with anxiety, is breath, magnesium, and acupressure. So there are some acupressure points I would recommend you look up before you take a journey. I would also, if I were you, have, say, Fireside Chat's phone number on hand, just in case it gets to be too unbearable for you. Or if you have a sitter, obviously reach out to the sitter, that kind of a thing. But again, magnesium, it can really turn things around. It's amazing how much of that anxiety is body tension and hypertension, and perhaps you're low on electrolytes, right? So I'd start there. There's, again, all the other stuff, but that's my favorite. Okay, let's talk a bit about body tension, right? This is one of these classic symptoms on psychedelics that it's just part of the territory here, depending on where you're at and what you're feeling, depending on the medicine you took, depending perhaps on whether it's a precursor or an abstraction of a molecule or the pure molecule, et cetera, et cetera. Maybe your diet, how well slept you are, how stressed you are. Could be a lot of things that kind of go into the body tension bucket here, right? Now, part of what's interesting to me about body tension on psychedelics is that if you look at perhaps the neuroscience of body tension and the neuroscience of psychedelics, they're going to give you one very particular angle here, which is that generally speaking, what muscle tension is on psychedelics is this flooding or this overactivation of all the serotonin receptors in your body starts to over signal. And serotonin has a huge control on muscle tension and muscle signaling. Tension and release of muscles is very much mediated by serotonin. So the more you're kind of increasing this experience of serotonin in the body, you'll get kind of like, jaw tension. You'll start to get, other kind of muscle tension in places you normally can't really control it so much, as well as like, spasms, that kind of thing. So all very, very normal, twitchiness. From a psychonaut, yoga, holistic, spiritual perspective, what's interesting here is that their angle is that this is accumulated stress or tension or not letting go or resistance, closing down and fighting what you might think of as, the life force, the chi, the prana moving through the body smoothly and evenly. And what's interesting to me about that isn't so much that idea, but that if you kind of take their advice of breathing into it, learning how to relax into it, consciously working with the tension, opening to the tension, exploring the tension, feeling into the tension, and really consciously working with it, maybe stretching, doing yoga poses, you can absolutely loosen up and soften that tension and find yourself feeling so much better, so much more balanced and clear and open. And so it really does beg the question, well, is it stuck energy or is it, serotonin over signaling? Or maybe that's kind of the same thing, two different ways of describing the same thing. I don't really know. But what I found to work really well is kind of what I just mentioned here. So yoga and stretching. If you've never done yoga on psychedelics and you do use psychedelics, I would highly recommend checking it out. It's pretty freaking incredible. If you really get into a groove with stretching, it is so rewarding, so blissful, so nourishing and healing and life affirming and comforting and grounding. Highly recommend it. I would also encourage you to explore, again, breath work. using your breath to modulate the tension in your body, right? Whether, again, you're doing box breathing or you're doing, heart coherence breathing would be an awesome one. Stuff like that, and start to modulate the amount of tension in your body through breath. That's going to be super powerful. Another one, as kind of cliche as it is, and not something I gravitate to for, say, trauma work, but just for raw tension in the body, shaking, bouncing, wiggling it out. Just like if it's just you or it's you and some homies that you trust, just shake it out, and do them, wring your hands out and shake your arms out and just spaz it out. As funny as that sounds, it works super, super well. So I'd definitely recommend just trying shaking, and, you could also kind of wring your muscles out, kind of do some self-massage if you're good at massage, that kind of a thing. But I would try any and all of these. Also with body tension, like I was mentioning earlier, magnesium, not only great for anxiety, but body tension. There's a lot of overlap there between anxiety and body tension, obviously, right? So magnesium, again, super clutch, super, super useful. And try all of that. Breath, yoga, magnesium, stretching, movement, shaking, working with it, allowing it. And generally, you'll kind of move through a phase where you have body tension. If you really actively work with it, you'll balance yourself out. And then oftentimes the rest of your journey, or most of your journey, it won't continue to be a struggle. So if you're in that phase of dealing with body tension, I would just kind of work it out, work through it, slow down, spend some time with it. It's worth working on. And then once you're feeling right, it probably won't come back. So that's my thoughts on body tension. Okay, now I know I've already yammered on about some of the key points here. I wanted to just add some other kind of really crucial kind of levers you can pull to make yourself feel more comfortable and really take care of yourself on a trip here. So, these each could be explained in much more depth, but just kind of roughly speaking here, I would say in general, for whatever you're dealing with, whether it is anxiety, depression, maybe dizziness, maybe digestive discomfort, all kinds of stuff, I would look at acupressure and acupressure points for whatever it is that you're dealing with, and consider just taking 10 minutes out of your trip to do some acupressure. It can totally change things. Game changer sometimes. So acupressure in general, highly underrated. By the way, yes, there is science that backs up the efficacy of acupressure. It's not pure woo. It's repeatable. It's measurable. It's a thing. Okay. Grounding. So if you are getting ungrounded, you're getting manic, you're getting too energized, you're getting spaced out, you're getting dissociated, you're getting uncomfortable, you're getting overwhelmed, slow down. Breathe deep. Maybe lay down on the floor, right? Lay out like a comfy spot on the floor, or just sit and ground. Just let yourself ground out, especially in the beginning as you're coming on, maybe getting overwhelmed. This is really, really helpful. Another huge one here, obvious in terms of set and setting, but still worth saying because we're talking about in play during the journey, during the experience, shifting things in your environment if something's not to your liking, right? So this could be, the obvious one is music, right? If you're listening to music that is triggering certain emotions in you, you don't want to feel, or doesn't fit your mood at all, or, feels wrong in one way or the other, shift the music, turn it off. If the music's, if you can't agree with other people or whatever, or you can't find something you like, or pivot to something you probably would like, or that does feel right to you, shift the music. Another huge one here that's really underrated is smell, right? So again, if you're smoking a bunch of weed with everyone and the whole room or the whole space smells like weed, maybe open some windows, let the weed smell out, maybe light some incense, or whatever it might be for you. For me, I really like essential oils in a diffuser, incenses sometimes, sage if you need it, that kind of a thing. But also Yeah, smelling beautiful essential oils. I've even spent moments on a journey like smelling fruit. Like I'll pick up like a banana and just smell it and enjoy the beauty of that smell. Smell is a real direct influencer of your neurochemistry. It goes straight into your brain. You're like, boom. So smell is a very powerful one. So if something is off smell-wise in the space, air it out, clean it out, get a better smell going on. Another one here would be blankets, clothes. If you're, for example, uncomfortable in a piece of clothing, change your clothing, take it off, wrap yourself in blankets. If you're feeling kind of vulnerable and exposed, weighted blankets are very popular now with people doing medicine work because they're just so comforting and kind of anxiety reducing. Soft things, comfortable things, right? So if you're wearing tight clothes, maybe you want to change into some more comfortable clothes, that kind of a thing. Another thing here would be lighting, right? Like, what's the lighting in the room like? Is it intense? Is it overwhelming? Is it too dark? Is it lacking in color and vibe? Is it too vibey and too colorful and too overstimulating? Lighting, right? Really consider lighting a lot. All of those things, any of those things, I've had all of those be major moments of pivoting the tone and the feeling of a trip. So, again, all those things, as simple and basic as they are part of your setting. When you're on the medicine, you're very susceptible to your setting and how it impacts you on a kind of subconscious level. And so I would strongly encourage you to adjust all the things that need adjusting, right? Should be a given, but again, some people just think set and setting before, they don't think during, right? So again, hydrating. Again, another obvious example here, but people come in underhydrated. Throw some electrolytes in a water bottle. Make sure you're hydrated. Make sure you're peeing clear. Psychedelics are often diuretics, so you probably won't have a problem with that. But hydrate. It's another huge one. If you're dehydrated on the medicine, it can be very uncomfortable. So make sure you're hydrated. Taking breaks. Right. So this is another big one here. Sometimes you get really into like a train of thought. It's really intense and you're really processing and really thinking things through, or you're really tripping out on some mental puzzle that you're wrapping your head around, or some philosophy or integrating or whatever it is, or having a heavy conversation with someone that's like deep. It's like rad, but sometimes you're noticing yourself getting a bit too engaged, too stimulated, too tense, too uncomfortable. Maybe you're listening to an Alan Watts thing and it's a little too much, or whatever. You're listening to music and it's too much. Hit the pause button. Step outside or don't. Step outside your room or don't. Take a break though. Okay. So this is another big one that people don't talk about. It's okay to kind of hit pause on whatever you're doing. Break the flow for a moment. If it's too much, pump the brakes and just chill. It's all good. And last one I'll mention here, which is a huge talking point, quite frankly, but I'm just kind of peppering it in here. Bringing compassion to whatever it is you experience. So again, if you're feeling uncomfortable in whatever way you are, again, you're feeling vulnerable, you're feeling overwhelmed, you're feeling confused, you're feeling emotions come up, you're feeling overstimulated by, again, your environment or whatever it might be, bringing compassion to that experience, being kind to yourself, being tolerant and patient and gentle with yourself is often, as simple as that sounds, another one of these kind of moves that really can pivot the whole tone of your trip and make things much more beautiful and tolerable and easy and deep and sweet. So another way you can go here, if you're struggling, is to just bring some compassion to yourself or to your journey mates if you're tripping with others on your journey. Always, it's never bad. Like gratitude. Gratitude is another one. You can always be grateful for things in life or things that are going right in life, and that's always a positive. I don't think you can have too much gratitude. I also don't think you can have too much compassion. So We're going to wrap here because this video is longer than I anticipated it to be, but hopefully this is useful. So let's summarize really quick and then we'll call it a video. So what do you think? Does this hit home for you? Is this stuff you already knew, or did you learn something new here? Leave a comment down below. Let me know. It would really help. I'm trying to kind of make more kind of practical psychedelic content here alongside all the therapeutic and theoretical and spiritual and all the other stuff. And so I want to know if this hits home or if this is useful for you in terms of your relationship to psychedelics. So quick summary here. Again, this video is about, what to do on a journey to care for yourself more. This is not the be all end all. There's plenty more to talk about. And if you have questions about other aspects of self-care on a journey, do let me know. I'm happy to kind of answer those questions and make more videos about that. Again, ginger, hydrate, magnesium, stretch, breathe, shift your environment if you need to, be compassionate towards yourself. I think that kind of sums it up for now. All right, guys, I'll see you in the next one. Take care.